Hi, this is Proaction Sports Injury Clinic. I'm Shane Bayless.
And I'm Lindsay McMullen, and we're here to talk to you about active release technique. Active release technique is the gold standard for soft tissue work, and it's one of the primary technique tools that we utilize in this office. The technique was originally developed by chiropractor Dr. Leahy, and it's been known to treat a lot of chronic conditions.
So a lot of chronic conditions are there because of scar tissue. So it's one of the main things that we're breaking down in this clinic, from shockwave, ART, Graston, even sometimes medical acupuncture that we're using to break down scar tissue. So scar tissue is basically a very fibrous tissue. It's not very flexible and it's not very strong. So if you can't stretch, you can't be flexible, and if you can't contract, you can't be strong. So that's why we basically treat it quite a bit of times, because that's a lot of people's symptoms that come up when they have a lot of scar tissue buildup. All right, scar tissue can be in muscles, in ligaments. It can be between muscles and ligaments, or between muscles and muscles. And it can also be between ligaments and nerves, or muscles and nerves, making a nerve entrapment where you lose flexibility in that case as well. So treatment-wise, when we're treating for active release technique, we take a muscle that's short. So if we're taking the forearm, for example, we'll bend the wrist a little bit here. We're going to take our specific spot or site that we find the scar tissue in. I'll put a little bit of a compression in there, and then a little bit of a tension upwards towards the muscle fibers. Each muscle fiber has a certain direction, and you want to go through those directions, so you're sending a positive message to the muscle, which is actually the fibroblast cell, that creates more collagen or muscle fiber in that direction, which will make you stronger overall, which is oftentimes when we see right after treatment a stronger response with the muscle contraction. So I go here, I compress, I tension, and then we lengthen out the muscle. And once we get the muscle lengthened fully, we actually trap the scar tissue to break it down so that it doesn't just flop underneath. Like sometimes when you're using massage, if there's no tension on the muscle, it'll just kind of bend underneath your contact. So we're doing that shorten, and we lengthen, and I can feel it kind of break down.
So as you can see, sometimes we can get some redness as a result of treatment. There are residual effects that can occur with active release technique, or ART, as it's commonly known. Some of these residual effects can include some sort of residual soreness, usually about 1 to 3 days post-treatment. So often what we'll do is we will see patients every other day initially when we're dealing with chronic conditions. There can also be some bruising and swelling, but typically patients will recover fairly quickly from dealing with from treatment. So in terms of common conditions that we do treat, these can include nerve entrapment, so any sort of peripheral nerve entrapment that most patients would know would be sciatica. That would be a common condition. There's also certain muscle strains or ligamentous sprains that can come up. Other conditions can be commonly known issues such as tennis or golfer's elbow, including also jumper's knee, and as well as any sort of chronic tension, headaches, cervicogenic headaches that come up, as well as kind of your typical neck, back, and hip pain, and shin splints as well. So in summary, active release technique is a wonderful technique for dealing with chronic conditions, and it's something that we utilize very readily in our office.
Every day we're using it to treat sports injuries, regular day activities, occupational injuries, all those typical things. So I hope that gave you a little bit more information about how we use active release technique, as well as kind of the principles on how it works. And hopefully we can get you a little bit better if you come into the clinic and take a look at what we can do for you using our active release technique.
Thank you.
Have a good day.